Everyone, I'm Dhanshri bawankar from BSc 5th SEM and I'm student of Dr. Hari Singh Gaur Central University Sagar. Today I'm here to talk about introduction to concept of autoimmunity and immunodeficiency. So I'm starting my topic autoimmunity. Firstly, I will tell you discovery of autoimmunity. Paul Ehrlich at the turn of the 20th century proposed the concept of horror autotoxicus. Ehrlich later adjusted his theory to recognize the possibility of autoimmune tissue attacks but believed certain innate protection mechanism would prevent the autoimmune response from becoming pathological. By the 1950s, the modern understanding of autoantibodies and autoimmune diseases started to spread. More recently, it has become accepted that autoimmune responses are an integral part of vertebrate immune systems. Our next point is what is autoimmunity? The immune system defends the body against infections and certain other diseases. It is made up of different organs, cells, and proteins known as autoantibodies. Sometimes the immune system makes a mistake and attacks its own tissues or organs. This is called autoimmunity. It identifies, attacks, and destroys germs and other foreign substances. Autoimmunity is the presence of antibodies which are made up by B lymphocyte and T lymphocytes directed against normal components of a person. Now we will talk about how does autoimmunity develop. When the body senses danger from a virus or infection, the immune system kicks into gear and attacks it. This is called an immune response. Sometimes healthy cells and tissues are caught up in the response resulting in autoimmune disease. It is generally believed that autoimmunity is triggered by the development or activation of CD4 helper T cells that react with a specific autoantigen. Based on various evidences, it is now proposed that a specific stimulus is the first trigger of autoimmunity. After the knowing the autoimmunity's development, I'll talk about mechanism of autoimmunity. Autoimmunity is generally defined as a phenomenon in which antibodies or T cells react with autoantigens. Autoimmunity induces autoimmune diseases. The immune system has various mechanisms to suppress the immune response to the cell, and the disturbance of this mechanism results in autoimmune diseases. Proposed mechanisms for introduction of autoimmunity. A variety of mechanisms have been proposed to account for the T cell diseases, and it is likely that autoimmune disease does not develop from a single event, rather from a number of different events. So here are five proposed mechanisms of autoimmunity. First one is forbidden clone. Mutation in the lymphocytes may result in the formation of changed or altered clone. This altered clone may recognize host as foreign and lead to development of autoimmunity. Altered antigen. Some of the antigen on the host get altered by chemical, biological or physical means, thus form new antigenic determinants which may be recognized as foreign by the host. Third one is sequestered antigen. Some of the antigen in the body are hidden from cells of immune system. If the organs containing such a antigen are damaged, it causes exposure of sequestered antigen, thus an immune reaction to this antigen may occur. Immunological deficiency theory. According to this theory, mutation or loss of immune system results in a condition in which self-antigen behaves as foreign. Fifth and last one is genetic influence. This was determined by family studies. It is well recognized that certain immune disorder predominate in females. This has strongly supported the role of genetic influence in autoimmunity. After this, we will see types of autoimmunity. On the basis of pathogenic mechanism, autoimmune diseases are classified into two types. First one is organ-specific autoimmune disease and second one is systematic autoimmune disease. So in organ-specific autoimmune disease is directed against the component of one particular type of organ. The organ-specific autoimmune disease can further be divided into two groups. First one is autoimmune disease mediated by directed cellular damage, and second one is autoimmune disease mediated by stimulating autoantibodies. And in systematic autoimmune disease, it is the type of autoimmune disease which is directed against an antigen that is present in many different sites and can include involvement or several organs and tissues. This disease reflects a general defect in immune regulation that result in hyperactive T cells and B cells. After this, we will see the symptoms of autoimmune diseases. The early symptoms of many autoimmune diseases are very similar, such as brain fog, dry skin or rashes, weight loss or gain, rapid heartbeat, abdominal pain, muscle pain, and more. Individual disease can also have their own unique symptoms. Symptoms might come and go over the time. So after this, examples of autoimmune diseases: Graves' disease, myasthenia gravis, Hashimoto's thyroiditis, good pasture syndrome, and more. After knowing the concept of autoimmunity, everyone wanna know about that, is autoimmunity good or bad? So an evolutionary anthropologist, Aaron Blackwell, said autoimmunity has previously been considered to be a bad thing and the consequences of the immune system misfiring instead of attaching what it's supposed to be. So here I am finishing my topic of autoimmunity, and after that we will see immunodeficiency. Discovery of immunodeficiency. Two Swiss group of from Bern and Zurich discovered similar patient in 1958 and recognized it to be an immunodeficiency. This condition, that was initially coined as Swiss type agammaglobulinemia, which is lack of gamma globulin in the blood plasma, was renamed as severe combined immunodeficiency by World Health Organization in 1970. In 1954, Robert Good discovered a fatal granulomatous disease that is now known as chronic granulomatous disease. Immune deficiencies can be described as primary or secondary. While primary immune deficiencies are due to inherent dysfunctions of the immune system and are chiefly genetic in etiology. Secondary immune deficiencies are consequent to other underlying causes. Now after this, we will talk about what is immunodeficiency. Immunodeficiency disorders impair the immune system's ability to defend the body against foreign or abnormal cells that invade or attack it, such as viruses, bacteria, fungi, cancer cells. As a result, unusual bacterial, viral or fungal infections or lymphomas or other cancers may develop. Immunodeficiency disorders involve malfunction of the immune system, resulting in infections that develop and recur more frequently, are more severe, and last longer than usual. After this, we will talk about how does immunodeficiency develop. Immunodeficiency disorders usually result from a use of a drug or from a long-lasting serious disorder such as cancer, but occasionally are inherited. People usually have frequent, unusual, or unusually severe or prolonged infections and may develop an autoimmune disorder, cancer. Another problem is that up to 25% of people who have an autoimmune disorder also have immunodeficiency. In an autoimmune disorder, the immune system attacks the body's own tissues, as I told earlier about autoimmunity. Types of immunodeficiency. First one is primary. These disorders are usually present at birth and are genetic disorders that are usually hereditary. They typically become evident during infancy or childhood. However, some primary immunodeficiency disorders are not recognized until adulthood. There are more than 100 primary immunodeficiency disorders. All are relatively rare. Second one is secondary. These disorders generally develop later in life and often result from use of certain drugs or from another disorders such as diabetes or human immune deficiency virus infection. They are more than primary immunodeficiency disorders. Some immunodeficiency disorders shorten lifespan. Other persist throughout life but do not affect lifespan, and a few resolve with or without treatment. After this, we will see symptoms of immunodeficiency. Infections of mouth, eyes and digestive tract are common. Thrush, a fungal infection of the mouth, may be an early sign of an immunodeficiency disorder. So it may form in the mouth. People may have chronic gum disease and frequent ear and skin infections. Bacterial infections may cause pus-filled sores to form. People with certain immunodeficiency disorders may have many large noticeable warts. Many people have fevers and chills and lose their appetite and weight. Abdominal pain may develop, possibly because the liver or spleen is enlarged. Infants or young children may have chronic diarrhea and may not grow and develop as expected. Immunodeficiency may be more severe if symptoms develops in early childhood than if they develop later. Other symptoms vary depending on the severity and duration of the infections. Next one is treatment. General measures and certain vaccines to prevent infections, antibiotics and antivirals when needed, sometimes immune globulin, sometimes stem cell transplantation. Treatment of immunodeficiency disorders usually involves preventing infections, treating infections when they occur, and replacing parts of the immune system that are missing when possible. With appropriate treatment, many people with an immunodeficiency disorder have a normal lifespan. However, some require intensive and frequent treatment throughout life. Others, such as those with severe combined immunodeficiency, die during infancy unless they are given a stem cell transplant. Is immunodeficiency good or bad? Inherited combined immunodeficiency affects both T cells and B cells. It may be deadly within the first year of your life if it isn't treated early. People are said to be immunosuppressed when they have an immunodeficiency disorders due to medicines that weaken the immune system. So here I am completing my topic immunodeficiency. After this I added a extra topic difference between autoimmunity and immunodeficiency to clear the things between the topics. When your immune system fails to respond adequately to infection, it's called an immunodeficiency. People may also suffer from the opposite condition, an overactive immune system that attacks healthy cells as though they were foreign bodies, and this is called an autoimmune response. So, but keep in mind, both scenarios can create potentially life-threatening conditions. So here I am finishing my concept of autoimmunity and immunodeficiency. Thank you so much for listening my presentation, and special thanks to Dr. Dipali ma'am for giving me this opportunity.